Hey everybody, welcome back to another episode of Digital Health Entrepreneurship Daily. If this is your first time here, I'm Seth Silvers, and this is part 2 of a episode where we talk about how COVID is impacting the healthcare system. Our last conversation, we talked a little bit about how it's impacting the health system right now. And in this second part of the conversation, we talk about some of the long-term impacts, some of the ways that it is impacting the healthcare system of the future. So without further ado, let's dive in and hear from Laurence on how COVID-19 is impacting the future of healthcare.
Hey, Laurence, I know you're not a medical doctor and you're not an economist. Do you have any opinions that are fun to talk about that relate to reopening cities, reopening states, or even reopening the country?
I'm certainly not the world's leading public health expert here, but hopefully we'll have that person on the show soon. But I don't know. I was watching Governor Cuomo speak last night about New York, and I believe the cases are on a decline in New York, whereas in other states they're not on a decline; they are increasing, and they're still reopening. And so I guess in certain states they
like
just
Colorado.
and they're just prioritizing the economy, it seems like, which I guess is valid. I mean, right. If you need money and you need to work, I mean, at some point you got to leave your house, I suppose. But I guess I'm just not an economist, but like you would hope that the government would provide as much support as possible. I mean, the payroll protection program is interesting. I mean, Fruit Street got some money from that, but I wonder if that is the solution. Like, why not? And maybe they're doing this already, but why not do that with every American directly with their bank account, right? And I guess you have things like that with Social Security and that kind of thing. But I just wonder if their system for this is that robust, right? Like, does the government, for example, have a list of everyone's bank account information where they could just deposit money into every American's bank account instantly? I'm not sure that they're set up to do that, but they probably should be.
Yeah. And I think with the stimulus check, I think they were able to do that with like 70 million Americans or something. Like they pretty much just did a direct deposit right away. But I know I think some Democratic senators are trying to propose another stimulus that would potentially be like $2,000 a month per person in a household.
I didn't realize they were able to do direct deposit, but that's still not every American, right? So you wonder, well, why wasn't it more? I mean, maybe it's just based on income or something like that. But I mean, it seems like they should have the ability to do that, which kind of gets back to what was his name, Andrew Yang, that was running for president.
Yeah,
his idea of like universal basic income, the whole idea that because we have automation and robots and that kind of thing, we should just provide that wealth that's generated from that to every American in the form of $1,000 per month, which I think makes sense. I mean, I think that what everyone's starting to realize is that, well, hopefully, is that you can't just, protect the 1% or the top 10% or the top 50% of people in this country in terms of their income and wealth, because then what happens is, well, you have an infectious disease that breaks out and you haven't been providing healthcare to the lowest income people in society. Mm-hmm. And that actually affects the highest income people, because now you have a bunch of people walking around that could infect the wealthy people, right? So, I think hopefully what will happen is that we'll realize that it actually benefits the wealthiest Americans to take care of the, lowest income Americans, because at the end of the day, that's who's walking around, right? You don't want, infectious diseases spreading in society. And, if you don't have health insurance right now, what do you do? And, there's starting to be like free services that are popping up. But I'm sure that if we had a universal healthcare system where everybody had a doctor, right? I mean, we would not have as many cases of the virus right now, because people would have gotten access to doctors faster and the healthcare system would have been more robust. So I think that's an interesting economic decision we're going to have to make. Maybe it'll wake people up to provide universal healthcare.
So how are you guys, with covidmd.com, for example, it'll be extremely helpful in this season and stuff, but what are some changes that have happened or innovations that you've seen happen that say something like this happens again in 5 years that you think we're better prepared for and stuff? Like if we went through this again, what do you think the healthcare industry would do differently in America?
Well, Medicare just decides to permanently pay for telemedicine. So that would be one thing that hopefully is just a permanent change, which would put us in a better position in the future. I think that like a lot of these technologies, these telemedicine platforms will hopefully, build in things like contact tracing, lab testing in advance. We were thinking about for COVID-MD that even if this all goes away, could we almost be like the equivalent would be like a missile defense system, something that you never use, but you need to have, right? Like if somebody launched a missile at the United States, we spend like billions of dollars on that technology. So, why not have government funding for even private companies that are working on like, okay, if an infectious disease breaks out, there's going to be an app where people can video chat with the doctor, get at-home testing, do contact tracing with their mobile app, and that kind of thing, rather than just waiting. And that was the whole point of the pandemic response team that was assembled by the Obama administration that, I think Trump disassembled. But why not just be prepared for this in advance and put more money into public health, not just in preventing diabetes, but being prepared for, an infectious disease breaking out, and also doing things like having more masks available, having larger stockpiles of ventilators. I mean, I think that, our society maybe hasn't put as much money as they should have into public health. As you know, I'm a big soccer fan, and I think there was some video clip on LinkedIn about like, what do you expect to happen when you pay a soccer player $100 million and you pay a public health researcher $40,000? Well, every kid wants to be a soccer player instead of a public health scientist. So I think maybe we need to shift our priorities a little bit.
Yeah. Hey, Laurence, where do you get your information from? So like months ago, like I was very concerned and I wanted to buy masks. And then I was informed that, like people probably shouldn't buy masks because the emergency workers needed them first. Where do you get your information from? Like, is it New York Times? Is it CDC.gov?
Yeah, I use LinkedIn a lot because I kind of see what the smart people in my network, like the doctors, are promoting in various articles. I do watch CNN probably too much as well, but it's kind of like a combination of LinkedIn and CNN. And then I'll like ask a doctor specifically. Not everybody has access to that, but I remember when they first started saying not to wear masks, and I was just sitting there like, there's no way that's true. I mean, because if you just think logically about it, right? If the primary way the virus spreads is through, airborne droplets from people coughing, sneezing, that kind of thing. I mean, even if it's not a 100% protection, you'd have to think that a mask would protect you. So, I guess sometimes you need to just do critical thinking and not just believe everything you see on television. But those are my news sources.
That's been I think it's been kind of a fun game that's also discouraging, is when you hear one thing in the media about COVID and one recommendation or one, hey, this is now true, or this is the new thing we know about the disease. Within about 5 minutes, you can immediately find another very reputable source that's saying the complete opposite in like the media or the news and stuff. So I've often found myself like I'll see a story and then I'll actually pull it up on several different news sites. And not that you get an unbiased, I mean, I don't really believe in unbiased responses. I think everybody's biased to an extent, but I think it's been one of the challenges has been what's the, knowing the different opinions and knowing the different information and stuff. Before we started this call, you talked about how some of these changes are going to last and some are probably temporary. What do you think are some of the temporary changes to healthcare, and what do you think are some of the lasting changes to healthcare?
I'm not sure what the temporary ones are. I mean, obviously, not being able to physically see doctors is going to change, where we are going to start physically going into doctors' offices again and doing, elective surgeries. The permanent changes are more like hopefully permanently paying for telemedicine and further adoption of digital health solutions. You would also hope that they put more funding into just like basic biological research and public health. So hopefully that is permanent as well. And hopefully Joe Biden gets elected, because I'm sure that he is going to put more dollars into the healthcare system than President Trump has. So, I mean, I think that, just doing things like disassembling a pandemic response team. Like, just not very smart, right? I've actually heard like Joe Biden speak at the Startup Health Festival every year, and I know he's really big into putting dollars into the healthcare system. So, because I think everybody is so obsessed with like, oh, well, President Trump, the economy's doing so well. And like, it was doing so well, but he dissembled the pandemic response team. And so, well, guess what? When you don't take care of the, health of the nation, and you do things like you just are not concerned about a global pandemic that could erupt, right? That damages the economy at the end of the day. So I think that we need to start realizing that the health of people can directly affect the economy, not just with like chronic diseases like diabetes and obesity, but also with infectious disease. I think that in developed countries, we've kind of thought like, oh, infectious diseases are a thing of the past, right? And now what kills people is non-communicable diseases like diabetes, heart disease, stroke. But apparently that was not true. And I think that we need to start realizing that because of global air travel and that kind of thing, that infectious diseases are not something that just affect developing countries, but also developed countries as well, which hopefully means that we also put more aid dollars into helping developing countries improve their healthcare systems, because now we have global air travel. So if they don't have a good healthcare system and they don't have vaccines and that kind of thing, they're going to cause a problem in developed countries when they, visit and that kind of thing. So those are hopefully some of the things that we change.
Yeah. Can you just give us some of like let's just talk opinion and conjecture here. Like I'm in Colorado. Lawrence, you guys are like in like the hotbed of New York City. Like all eyes in the world have been on New York City for the last like 6 weeks. So like, what do you think the next like 6 months is going to look like? Like, are people going to get on planes, or like, are people walking outside right now in New York City? Like, give our listeners that are not in New York City an understanding of what it's like now. And just like, what do you think it's going to be like over the next couple months?
Everything's basically closed except for grocery stores and pharmacies. And like coffee shops have started to open, but it's like mobile pickup only. So when you go to Starbucks, you cannot go in the store, right? You literally have a Starbucks employee at the front door that hands you your mobile order. So every restaurant is mobile pickup. Even fancy restaurants are being forced to do like mobile pickup at like Del Frisco Steakhouse and that kind of thing. So everything is kind of mobile pickup at the moment. People are walking around, but like 99% of people are wearing masks. There's people that are like walking around in the park and that kind of a thing. You have, people biking that I can see from my apartment and that kind of thing. So people are getting outside because it's starting to get nicer. But I think in New York, people are taking it pretty seriously. I don't know what it's going to look like. I mean, I'm wondering myself, like when I can get outside and play soccer again, when they're going to open soccer fields, and also just when restaurants and that kind of thing will open. I'm kind of curious to see what will happen on May 15th when supposedly the New York State, I think it's called like the pause order or something, expires. Like what's going to happen on May 15th? Is that going to be the point at which things start to reopen? So it is very hard to say. And I think that in New York, at least people will probably still stay at home, even if they're not required to by law, because I think that people are just being really careful. But it's not like, the doomsday scenario. I mean, people are going out on their bikes and that kind of thing, which maybe is a good thing and a bad thing. I mean, people are starting to exercise and that kind of thing. But I think the most dangerous diseases are ones where you don't have any symptoms, but there's a problem, right? Like, why is blood pressure called the silent killer? Well, because you can just drop dead from a heart attack one day and you don't necessarily have any symptoms. So I think that people are starting to act a little more normal, but they are wearing masks, which is good. But I think there's maybe a risk that people start getting too relaxed because, after 2 months of like nothing happening to you on a personal basis, I think some people are just like, well, it's not going to happen to me, so I'm done with this kind of thing. They're over it,
Yeah.
But no.
Yeah. There's a part in there that bugs me a bit when I'm outside. Occasionally I'll see some teens and they're not wearing masks, they're just hanging out. And it's almost as if because they themselves are unlikely to die because of being infected, they don't worry about the mask, but they don't give thought to society might be worse off if they pass the infection to someone else. And anyway, that's just my opinion. It's my bugbear. Like when I go to supermarkets here in Brooklyn, the majority of people are in masks, but occasionally there's that one guy, who isn't. I'm like, who are you? Like, why are you in the supermarket now? I'm here. And you're like,
I swear the only time that I've sneezed in the last 2 months has been right when I walk into a grocery store or I'm like picking produce or something. And it's like, everybody, you just randomly have to sneeze and everybody gives you the look.
I've got a very embarrassing personal story, which I'll just tell you, just to be real. I'm wearing a mask. I'm in a supermarket, and I just have to sneeze, and it all happened within seconds. I take my mask off.
I was about to say everybody's doing
that. And like I sneeze like into my arm, kinda, and I'm just like, what happened? I'm supposed to sneeze into the mask. It was just like an automatic response. There was something.
Nobody wants to get their mask dirty.
And I'm like, I'm such an idiot. Like I was that moron. And video camera. I'm probably on the internet now, like that.
I think for many years to come, and probably decades, there will be things that are just done differently because of this. And so I think, like you said, Laurence, who knows how it's going to change us? But I think it's clear and easy to see that it's making some really important shifts. It's forcing some really important shifts in healthcare. So obviously COVID-19 is not good, but I think that the way that we're solving the problems is kind of bringing about some good things. So we'll continue to talk about this more and more as things evolve, and we'll see how things go on May 15th there in New York City for you guys.
Sounds good.
Thanks, guys.